We have Angela Patterson, is an advanced practice registered nurse, vice president at CVS Health, and chief nurse practitioner officer at CVS Minute Clinic. In her current role, Angela is accountable to providing clinical and professional practice governance for more than 3,100 nurse practitioners and physician assistants who staffs the organization's more than 1,100 retail health clinics located across 34 states and the District of Columbia. Her key responsibilities include leading the organization's clinical training and education, NP fellowship, professional practice advancement, and provider workforce recruitment and development. Angela also has a broader organizational and enterprise responsibilities, including senior level membership on key governance committees, including growth and new strategies, strategic planning oversight, quality, and patient safety.
Good morning. Thank you for the honor of presenting before the National Black Nurses Association, sharing and celebrating the work of nurses at CVS Health Minute Clinic. At CVS Health, our enterprise purpose is helping people on their path to better health. And nurses, the work of nurses, is an important part of helping our enterprise achieve this mission. At CVS Health, we are an enterprise that is comprised of a number of different subsidiaries, which together address a multitude of needs in healthcare across our country. And in several of these subsidiaries, nurses play a very important role in helping us to realize our mission. At CVS Specialty, for example, infusion nurses, nurse navigators, patient education nurses help to provide support to patients receiving specialty medications in areas such as safe administration, medication adherence, care coordination, general education, and support. Today, I'm going to focus on sharing the story of the work of nurses at CVS Minute Clinic, which is a retail medical clinic division of CVS Health, the pioneer of retail healthcare in this country, the largest practice of retail healthcare across the United States. And the statistics that form the landscape and the backdrop that provided the opportunity for nurses to champion innovation in care delivery are well before us and certainly eloquently presented by my co-presenter. 1 in 5 Americans currently lacking access to basic primary care. An estimated 50,000 physician shortage by the year 2020, millions of Americans entering the system newly insured, and access continues to be a significant problem. And certainly data presented in a 2010 Health Affairs study indicating that about 17% of all emergency department visits could be treated safely and with quality in lower-cost retail clinics, leading to potential annual savings of $4.4 billion. These kinds of forces happening across our healthcare landscape really herald the need for innovation in care delivery that provides convenient access, which is affordable and certainly maintains our commitment to high-quality and safe patient care. In addition, forces that continue in the chronic care space, chronic condition space, with 1 in 2 Americans living today with one chronic condition, at least 50% of Americans having diabetes or pre-diabetes by the year 2020, estimated costs over $3 trillion to our country, as well as an understanding that healthcare costs for patients with common chronic diseases are estimated to be about 5 times greater for one chronic condition. All of these forces, again, providing a tremendous opportunity for nurses as an integral part and workforce in our healthcare delivery system across the country to really champion advancement of health and well-being across our communities. At Minute Clinic, a concept that started a little over a decade ago, nurses play an important part in realizing innovation in care delivery across our countries. At MinuteClinic, we have grown tremendously over the past years and continue to grow and expand our span across the country, putting access to convenient, affordable, quality health care within the reach of millions of Americans. Today, we staff more than 1,100 clinics across 33 states and the District of Columbia. Our workforce includes more than 3,100 advanced practice nurses. We also have PAs as well as nurses, LVNs, on our workforce team as well. Our clinics are open 7 days a week, including evenings, holidays, weekends. In fact, we see the majority of our patients during off hours and on weekends, the majority. Our costs over the last few years remain 40 to 80% less expensive than other venues in our communities. And we continue to deliver on patient satisfaction, having patient satisfaction scores above 92% being highly satisfied, as well as continuing to practice evidence-based healthcare across our clinics across the country. In addition, another part of our group practice is with regards to interdisciplinary practice. We partner. We want to be a partner in the broader primary care medical neighborhood. Today, our organization has over 70 clinical affiliations with healthcare organizations such as Cleveland Clinic, Allina, UCLA, Advocate, and others. An important part of working together as a comprehensive team across the country to meet the needs of our patients and communities. At MinuteClinic, we see ourselves as filling the gap and providing additional access to care in our communities. We call ourselves the safety net for primary care, where we work very hard, our practitioners work very hard to work together with primary care providers in the community and provide that access to care when patients are not able to access their primary care providers. For example, if they're traveling or it's a Sunday morning and their PCP's office is not open, and certainly providing that access for point when folks find themselves medically homeless for a variety of reasons. We work together with our primary care providers and patients who present to us who do not have a primary care provider, and today our national average is about 50% of the patients who present for care at MinuteClinic report to us that they do not have a primary care provider. Our practitioners work to connect them to area PCPs who are accepting patients. And those who have PCPs and are using us as that access point when they're not able to see their PCP, we share, with the patient's permission, their medical record with their PCP to help support continuity of care and communication in our communities. At MinuteClinic, we have a strategic plan that is meant to support primary care across our communities. And it is comprised of 4 strategic pillars, the first being national footprint, where we work hard to place our convenient retail healthcare clinics in the pathway of patients in their communities, staffing them with advanced practice nurses. And today, with our current footprint, more than 50% of Americans live within a 10-mile radius of a MinuteClinic. And I'm exceptionally proud of that, to think that more than 50% of Americans are within a 10-mile radius of an advanced practice nurse. They're ready to deliver quality care in their communities. A second element of our strategy is regarding advancing the scope of service that we provide to our patients. Advanced practice nurses have tremendous education and training and can be our key champions in supporting forces that we face today with regards to healthcare needs of our patients. So in addition to sore throats and flu shots, which we're very well known for, our clinicians provide a wide array of services, including screening exams, support for patients with common chronic diseases, immunizations, as well as wellness services such as weight management support and smoking cessation. A third element of our strategy, which I'll share a little bit with you in just a minute, is our continued commitment to bring innovation to care delivery through the use of technology. So increasing work on telehealth and continually trying to think about ways that we can connect our advanced practice nurses and workforce team together with patients in their community. bringing the care to the patients. And then the fourth and critical part of our strategy, as I mentioned previously, is collaboration, connecting, working together across organizations as a combined and aligned effort to address the healthcare needs and challenges before us in this country. This is just a small snapshot of some of the organizations who we partner with and work with. And we work together at the local level, developing joint clinical programs, addressing the population needs within certain areas, and as well as working together on aligning around practice, evidence-based practice, and support, where many of the providers in our affiliate organizations are available for consultation to MinuteClinic providers, should there be a case that they wish to discuss. So again, it's around creating these new ways of working together to partner, to communicate, to talk, to certainly share our records in support of comprehensive care in the broader patient-centered medical neighborhood. MinuteClinic is proud to be Joint Commission accredited. This year marks our 10th year of Joint Commission accreditation. We recently had, this past fall, we had our national reaccreditation survey where I believe it was 17 states was surveyed across with a multi-member Joint Commission group. And I was so proud to receive the summary results, which had 0 deficiencies in processes of care and 0 deficiencies in infection control. So this is truly the work of nurses, delivering high-quality care across a virtual team across our country, work that we are so proud of and that nurses champion. In addition, we're a partner with the National Patient Safety Foundation in our efforts to help improve healthcare literacy, as well as we partner with a number of organizations together in support of the patient-centered medical neighborhood, as well as areas where clinicians, such as with pre-participation sports exams or others, where we continue to work together to provide access to needed care in our communities. One of the areas that we've been continuing to work in and understand how this helps us achieve our purpose, as well as how does it work for those who we serve, is an area in telehealth, where in several of our states across the country, we've been doing a number of pilots using telehealth technology. In particular, one particular pilot where we have an LVN who is placed in clinics, and patients are able to come in and receive care through telehealth. And using fiber optic peripherals and Bluetooth stethoscopes, as well as other technology, we're able to bring in an advanced practice nurse who's somewhere else in the state into the visit. And the patient is there with the LVN who supports them, registers them, does the point-of-care testing, education, discharge training, and we're able then to bring in the advanced practice nurse from a central location to continue to expand our reach and provide convenient access to quality care in our communities. Here are just some of the images that our practitioners who are providing the visit virtually are able to see, they're able to hear, and the technology is really quite amazing. We did, after having completed about 15,000 visits using this telehealth technology, we have put all of the visits through a rigorous quality control program because first and foremost, we want to make sure that this kind of innovation and care delivery meets our high standards around quality and safety, and this included 100% chart review, patient surveys, practitioner surveys, LVN surveys, as well as measured outcomes. And what we found was that there was no difference in quality and safety of telehealth visits when compared to our in-person visits. In fact, an interesting finding for us was 95% of the patients who received a telehealth visit were satisfied with the visit, said it was good, just as good as, if not better, than an in-person visit. And the interesting thing is, a third of those patients said it was better than an in-person visit. And our research continues in this space, and we think it's because of the interaction, and they're able to see parts of the exam that previously they weren't able to see, like their eardrums or their throats. We have, I think a lot about, does this drive medication adherence? Are there benefits to this that we can continue to explore? So this work continues in our organization, in our commitment to continuing to deliver access to exceptional care with nurses. At CVS MinuteClinic, our workforce works hard to continue to build a culture of health across our country. One area that I am exceptionally proud of the work of our nurses is in the space of antibiotic stewardship, where 95 to 98% of the time, our practitioners are following HEDIS measures on prescribing of antibiotics. And I'll tell you, it is hard work. This is work that is really hard that nurses are championing in our organization. Patients have been conditioned to come in and ask for the Z-Pak, and it's easier to give the prescription than to have the conversation and engage patients and and address their concerns about not receiving an antibiotic when it's not appropriate. And being available to them, calling them back in a day or two to see how they're doing, letting them know that you're there for them if they're not feeling better or if things start to head in a different direction. I'll tell you, our most common customer concern, and we've seen over 31 million patients to date, our most common customer concern is, I didn't get an antibiotic. I thought I needed an antibiotic, I didn't get an antibiotic. So this is really hard work in turning the ship on antibiotic stewardship. In addition, we work with the American Heart Association in support of the Million Hearts campaign. We use the Ask Me 3 program to help support health literacy. We work very hard as an organization around healthcare interoperability. So last year, we converted all of our clinics across the country from a proprietary EMR to the Epic platform. And part of the reason for that is more than 50% of the country's medical records are housed on Epic. And when organizations use Epic, it allows for a much streamlined and efficient process for sharing records across organizations. Prior to Epic, we internally were building connections to the healthcare, the EMRs of our strategic partners to enable that kind of record sharing. So an important part of the work we're doing to help connect across the country in support of healthcare. About a third of the adults we see in our clinics present with elevated blood pressure. So hypertension, pre-hypertension identification, and services to support blood pressure health in our patients is a huge initiative for us internally. We support the care of patients with diabetes, hypertension, hyperlipidemia, HIV and hepatitis C screening in select states, as well as we immunize across a broad array of immunizations, including travel services, our smoking cessation services, weight reduction, as well as a year ago, we decided as an organization, we made the decision to go narcotics-free. Understanding that opioid dependence in this country is everyone's problem, and we want to be part of that solution. And then certainly within the broader CVS Health enterprise, our commitment to remove tobacco and tobacco products from our stores was a big decision for us as an enterprise, and one that we stand behind wholeheartedly. And what we have found in some of our research is in those communities where that's where we removed tobacco from our stores, we found that as a secondary effect, we saw a reduction in overall tobacco sales across those communities from other retailers as well, leading to a broader impact in overall reduction in smoking across our country. In addition, we also saw in those same communities an increase in the sales of nicotine replacement therapies, so influencing smokers in their quit attempts. In addition, CVS Health continues its fight against tobacco, targeting high-risk groups such as teens, as well as expanding those efforts in partnering with organizations to address the opioid dependence problem across our country. In an organization such as CVS MinuteClinic, more than 31 million patients cared for by advanced practice nurses, it is our commitment to support the nursing workforce in this country, a very, very important commitment, and one that I spend a lot of my time supporting. Some of the ways that we do this is academic partnerships with institutions as well as national organizations such as the ANA, the AANP, the AAPA, the National Black Nurses Association, the National Association of Hispanic Nurses. We support colleges and programs for nursing programs. Today we have over 170 affiliations with colleges and schools of nursing across the country. Last year we precepted over 1,000 NP students in our clinics to support their education. Understanding that continues to be, clinical preceptor sites continues to be a barrier to admission rates in many of these schools. We have, within our organization, we've developed a preceptor program where we train and educate the preceptors within our organization to ensure a quality student experience for our nursing students. We have an NP fellowship program, which is currently entering its 4th year to help support transition to practice for newly graduated nurses in our organization. We follow evidence-based practice and provide a tremendous amount of resources around nurses to put those tools at their fingertips. So our EPIC EMR is all customized so that as practitioners are caring for patients, all the evidence is right there at their fingertips. We build clinical decision support tools to help support knowledge needs, and we create networks for clinical resource providers, both NPs as well as our consulting physicians, where if we have practitioners who want to consult around a case, there is always someone at the other end of that phone, or there's always someone available to them and dedicated to help supporting their practice and practice development, especially for practitioners who are continuing to develop in their clinical competency and confidence. We support nursing-led research and QI projects within our organization. We have a research committee which is led by doctorally prepared nurses within our organization. And we have internal emerging leader programs to help identify those nurses who are demonstrating leadership qualities or want to develop in that space for future management and leadership experiences and others. Nurses are an essential part of the success of CVS MinuteClinic, and it will continue to be so, and our commitment is to continuing to deliver affordable, convenient, high-quality care to those we serve, as well as create an exceptional experience for the nurses within our organization and support the education of nurses across the country. So thank you.